from the Quality Management Department with the Health Region here, and co-lead for Rpiw 59. The team will speak to a tack time of 20 minutes in this order. So our project had to do with reducing the lead time from lab being notified for collection to results being released in the emergency department, relating to a provincial motion of improving access and reducing ED waits. So some of the problems that we were given in our prep week were the fact that there's one medical lab assistant, or MLA, you're going to hear that word a lot today, doing processing of multiple patient samples, collection, data entry, carrying that pickup phone for emergency department and all the other unscheduled draws throughout the hospital, with no dedicated means of transporting those specimens back to the lab as they are going around doing those collections. We've got one medical lab assistant on the evening shift covering the entire big hospital. During the day, there's 3 or 4 of them working together, and they had no way of communicating with each other. We know that the MLAs going to collect in the emergency department were batching specimens because they would get there and have multiple collections to do. And again, as we said, no way of transporting those specimens back to the lab to get that processing going without delay. We also know that the MLAs and the nursing in emergency were sharing the role of doing ECGs, but there was some confusion about who was to do them and when, knowing that when an MLA had to do an ECG, it would double the amount of time that they needed to spend with the patient, at least double the amount of time. So our promise is that no patient in the emergency department will experience delays in care as a result of waiting to receive their lab results. Here is our amazing team, and everybody worked so hard and was so knowledgeable, as you will see when they do their report out. So this is our target progress sheet. You'll hear about the many improvements that we were able to make during our week. I want to highlight the unnecessary travel and movement of the medical lab assistant, as well as the ED blood samples. So you'll see that in the spaghetti diagram. The defects, our quality defects that we measured, had to do with the interruptions of that MLA carrying the phone, causing distraction, as well as potential patient safety issues during patient blood collection, a really critical task. Of course, during our prep week, we did a lot of time observation forms, and we're able to create a current state value stream map the week of January 9th to the 13th. I'll highlight some of the starbursts. That phone ringing causing distractions, we observed that. The MLAs, when there were 3 and 4 of them during the day shift, didn't have defined assignments, so no really good way for them to decide who was going to go where and who was going to carry that crazy pickup phone. We also, again, as I mentioned, ECGs, increasing the length of time for patient samples to get to the lab. Highlight here for you the sample collection. That cycle time we looked at for lab and ECG was almost 19 minutes. And then after that, we had a wait of just over 6 minutes. And those are the areas that we focused on in making improvements this week. Our lead time was just a little over an hour. We did tack time calculations for the 3 different shifts because demand and staffing was variable during those 3 different shifts. Our improvement efforts were focused on that day shift, but we know the improvements that we made will affect the other shifts as well. We had 73 total minutes available per day during that 8-hour day shift for each ER collection. So that's a tack time of 3.84. And you will see that the demand generated by the emergency department, they could not meet that tack time. So we did a lot of data collection as well in our prep week. This bar graph just shows the day shift, the evening shift, and the night shift. And so the blue bar here is the emergency department collections during that day shift, and the red bar is everywhere else. So, looking at that, we could see which departments were generating the work for the medical lab assistants in regards to patient pickup. The spaghetti diagram just shows the medical lab assistant not carrying the pickup phone with no way of communicating back to the lab, going about her collections and having to come back between each collection to check for her next assignment where she needed to go. So we noticed a lot of wasted movement and travel there. The next spaghetti diagram is related to the blood sample in the emergency department. So as they go and collect multiple patients, typically then patient A sample is going on a little walkabout of the emergency department as she's collecting the remainder of the patients. Our percent load chart, I just want to highlight for you our collection time of almost 19 minutes that we worked on during the week. The second bar, the big bar, is patient processing. We did not make any improvements there, as that's all machine time within the lab. And our standard work combination sheet, you can see that first big bar is our collection time as well, so we were able to work on that. And then the squiggly line behind that is that sample going on a walkabout. We did a 5S in our pre-week as well of Shelley's desk within the lab. And then we had a score of 1.5 to begin with, and we're able to improve that to a 2.5, and there is the post picture.
Hi there, my name is Rochelle Micklejohn, and I have been a medical lab assistant for just over 9 years here at the Victoria Hospital. Before the Rpiw, the MLAs had no way to communicate with their coworkers when they were being pulled in many different directions by the constant ringing of the phone, which in itself is extremely distracting during high-stress situations and difficult draws, and being needed by the many various departments at one time. Now, with the use of Vocera, we can have one MLA designated to the ER department by joining the ED Lab Assistant group through Vocera, primarily getting ER calls as well as using it to contact the porter to transport our samples back to the lab so we can continue to collect for the ER department. All other calls are now evenly distributed amongst all other MLAs, alleviating the stress of one sole MLA carrying the pickup phone, having to collect for the entire hospital. Before Vocera, we relied on sticky notes as our main means of communication with each other. Now, it's as simple as pressing a single button to ask for help and to communicate with each other. We are using the multiple skills training sheet to ensure that all MLAs are properly orientated to the new work standards for all changes implemented. During event week, we've had 107 incoming and outgoing Vocera calls. This illustrates the need for a communication device between the MLAs.
I'm Wanda Atchison, and I work with Population and Public Health Services for the region. And it was a real pleasure to work with the other participants and co-leads in this Rpiw. As you've already heard, the MLAs have a real mix of scheduled and stat lab collections to do throughout Victoria Hospital, along with meeting the demands of community members who are coming into the lab for blood work. We received several idea sheets from staff which referred to the need for scheduled assignments of duties instead of just dividing up the work as they came on shift on a daily basis. So developing standard work for each daytime MLA position gave us the opportunity for some load leveling. The standard work includes approximate times for each position to when they're responsible for stat collections from the ED, requests from other units, scheduled collection runs, availability to do walk-in patients, as well as to do their other duties. The use of Vocera was also incorporated into that standard work, which, as we've already heard, allows for primary assignment of taking ED calls to be split among the MLAs throughout the day, and calls from the other units going randomly to all MLAs and accepted according to their availability. Standard work was posted in the department prior to implementation, as you can see on this photo, and staff training was done for those who are working.
Hi everyone, I'm Carol Bell. I'm a medical lab assistant here at the Victoria Hospital. And as mentioned by Stacy, it was noted that multiple patient lab collections were being batched, meaning that the MLA collecting all ordered lab work on the patients in ER before bringing them back to the lab. The solution was to have an area in the ER where the labels could be placed and then utilize the porter to bring samples to the lab. This would decrease the delay in the blood samples getting to the lab and processing and speeding up the lab results. A work standard was developed for the MLAs to utilize the specimen drop-off spot and the ER porter. And as you'll see, those are 2 baskets for our ER porter to deliver the samples to the lab. And here's a picture of Jasmine, our ER nurse, and she's educating the new process to one of the porters. Next, labeling of tubes. The problem was noted that there was time wasting writing on patient's information on every tube. The proposed solution was to utilize the printer and the computer in the ER department and make labels for the tubes. This improvement was made, less time spent on the tubes, quicker flow to the next patient, and to the lab department. Thus, the results getting to the ER department quicker. A work standard was created for the ER ward clerk. Here's pictures of one of the MLAs writing on a tube. The next one was her just placing a label on the tube, much quicker process. And the next one is just a picture of the new labels.
Hi, my name is Shay Lucas, and I'm one of the ward clerks in emergency. Prior to the Rpiw, a few problems identified were, number 1, frequent defects on requisitions. So an idea we had was to just have all of the ward clerks completing the requisitions for consistency, and to retrain the staff when the ward clerk is not available. We've created a work standard process for this. Another problem we had was no designated spot for ECGs completed by the MLAs. An idea was to create a folder or a box on the ward clerk's desk next to the lab pickup box. MLAs will place the completed ECGs in the folder so they do not get misplaced on the ward clerk's desk. Then the ward clerk will take the completed ECG and A, give it to the attending ER doctor, B, give it to the attending RN, or C, place it vertically on the chart to alert attention. Another problem we had was no designated spot for ECG requisitions to be completed by the RN. So the ward clerk will complete the requisition, place the rec on the patient chart vertically to alert the RN that an ECG needs to be completed. And we have also completed a standard work process, and we are working with the staff to implement these changes.
Good afternoon. My name is Jody Hazelwood, and I am the patient family advisor who had the opportunity to work with this fantastic group. When patients are called in from the ER waiting room, the problem observed was that the MLA did not know what to tell the patient after drawing the blood sample. From a patient's perspective, this would cause confusion and frustration. Now the MLA will clearly instruct the patient to go back to the waiting room and inform the triage nurse that the blood has been drawn. The triage nurse will now watch for the results and decrease the patient wait time.
My name is Jasmine, and I am an ER RN. Just have patience with me as my baby attacks every organ in my body. The problems brought up with the idea summary sheets are that ECGs can take up a lot of time. Prior to Rpiw, MLAs were considered responsible for all ECGs. MLAs were expected to go to the waiting room, call the patient, wait for the patient, find a room for the patient, find a gown for the patient, wait for the patient to change into a gown, physically input the patient's information into the ECG machine, and then perform the ECG. All the while, the collected blood samples were on their cart. We have developed work standards that communicate when nursing is responsible to perform ECGs and when MLAs are responsible. Now the triage nurse will be bringing the patient into a room, asking them to change into a gown, and then the requisition will be made, and then the MLA is called. So there should be a decreased wait time. for that blood sample and the MLA weighting for patient. As well, ongoing training for staff is being done. With our skill training schedule, we've also got an app too, so we're using that to try and train all of our staff.
And I'm Tammy Blackwell, I'm the outsider in this crew, but so I'm the Director of Occupational Health and Safety and Staff Development from the Heartland Health Region. So I would like to thank the Health Region for having me so graciously welcoming me to co-lead this RPIW with Stacey. So at the start of our event week, we really dug deep with our team and we did a waste walk. So what that identified was we had 17 unique wastes. Over the course of our week, we have effectively eliminated 94% of them. We have one waste that we identified was still not completely cleared up. Our post-Kaizen value stream map, I'd like to just highlight that our value add time for our patient is now at 83.9%, up from 81.5%, and we have decreased our non-value add time. Overall, we have decreased our lead time down to 47 minutes and 30 seconds. So we are getting those results back to our ED patients faster. The only starburst that remains is the and-on flag system in eMERGE is not always consistently used. So the system is there, it's a really great system, a really good communication tool between eMERGE and the MLAs. So just some ongoing work there to make sure that it's consistently applied. We of course did time observations this week as we could in the emergency department. Of course, the curse of the RPIW, prep week and event week certainly came into play in that the emergency department was not quite as busy as we would have enjoyed. But anyway, you work with that, right? So our spaghetti diagram, the first one I'm going to highlight. This one is speaking to the MLAs and how much travel time they have. Stacey had highlighted that pre-event, they were walking close to 2,000 feet in approximately an hour. Post-RPIW, we've got that down to 873. That is a combination of them having the technology of Voicera to be able to communicate to each other, not having to go back to their home department to get their next assignment, as well as having those MLA work assignments so that they can anticipate where their work is going to take them. The next spaghetti diagram is actually looking at the parts travel. So Stacey as well had highlighted that pre-RPIW, the first patient collection would actually stay with the MLA as she continued to do the rest of her draws in eMERGE. So a combination of utilizing that ER porter on a more frequent basis will definitely impact this. So while we haven't necessarily decreased the steps that part travels, the pudding in the pie really is the time. So those samples are getting processed back to the lab quicker than they were previously. Our percent load bar, again, our Kaizen opportunities really focused on the time, that cycle of the patient sample collected, as well as the wait time in between collection and accessioning, getting the samples back to lab as soon as possible. Yeah, and now on to our target progress report sheet. I'm gonna highlight a few of our key improvements this week. So walking distance, so again for the MLAs, we've decreased that 34%. We've decreased the amount of steps that those samples travel, 15%. Our overall lead time for this particular improvement project has been decreased by 23%. Our quality defects have all been decreased by 100%. Effectively then, as a result of all of that, we have been able to increase the productivity and the capacity of the medical lab assistants. So the productivity has been increased 116%. They are able to do more collections because their work is more efficient. And we've implemented several other supports, as well as their capacity has increased 118%. Pretty significant. We do have a few outstanding newspaper items. Most of them are closed off. An example of one of the problems is the area that we 5S'd. There's a box on Shelley's desk that she keeps accuracy audits in. It's not suitable, so we have tasked Michelle with getting a wipeable basket. And the area that we trialed this week to put those completed ECGs is now we've decided what location is going to be permanent. So that will be up to the nurse unit manager to find a permanent place to keep those. Our workshop summary, some highlights of our improvements. We were able to trial Voicera for MLAs this week. MLAs now have work assignments. We have really good role clarification between RNs and MLAs on who and when they're performing those ECGs on ER patients, increased utilization of the ER porters, and 116% increased productivity in lab collections and emerge. A few lessons learned. Communication is the flavor of the day, as with always. It's an integral part of the problem as well as the solution. Every department is interconnected and interdependent on each other. We rely on each other for the delivery of quality patient care. And in this constantly changing world of healthcare, even though we live change all the time, change can sometimes be really difficult. Our thank yous, we have a lot. Mark, Cindy, the lab staff as well as the ER staff, Tammy, Yun, Pat, Richard, Michelle, and of course to Jody, our patient advisor, who provided your inputs, your valuable insights. You kept us grounded this week, reeled us back, and you made us all remember what our focus needs to continue to be. Yay, we're done.